Okay, so we're going to start. Again, welcome. Thank you everyone for joining us today. Today, we're going to talk about Caregiver Toolkit in Uncertain Time. Our presenter today is Melissa Sheehan and Laura Radensky. Melissa, she is the Director of Business Development at 305 Assisted Living, and upscale independent and assisted living and memory care community on the Upper East Side of Manhattan. And also we have Laura. She is, I have my note next. She is a licensed social worker and the executive director at Concern Home Managers for the elderly home care program, which is a licensed nonprofit home care providing home health aid services through the 5 boroughs. She has worked for over 25 years in home care and providing services at home care and social worker. She has been a supervisor and director in social work. And I know some of you, and we welcome all of you. Some of our attendees probably know a little bit about PSS, but I will just quickly do an overview about our services and who we are. PSS is a nonprofit agency who has funded in 1962. We are a multi-services agency who has mission to strengthen the capacity of older New Yorkers and their family to thrive. We have PSS Life University that offers a lot of educational training or other program online, especially in this time. We also do have 10 local senior centers in older locations, all designed to help older adults stay healthy, engaged, and connected. Our PSS Cove Care program, the one that I work under, provide free personalized support for those caring for someone who is frail, chronically ill, or has a memory loss issues. We do have our grandparent building. So this grandparent apartment is the first in the United States. It's built purposely for grandparent raising grandchildren. Our coming of age program inspires people 50 plus with passion and purpose. We're going to use the Q&A box in the chat to ask any question that you might have, and also use the ways and if one of you wants to speak to us and interact with us, right? Without further ado, Melissa will start.
Oops. Hello, how are you? I'm just having a technical moment here, sharing my screen.
It's okay. Let's see if I can. There you go.
There we go.
So you want to put in a slideshow to make it bigger.
There we go.
Okay.
Right. So certainly these past several months have been a challenging situation for everyone here in the metro area and certainly across the country, as we have all been receptive and gaining more information about how to deal with the COVID situation and reopening and sheltering in place and all the things that we've been working with. So it's been very increasingly important to have a mindset of being open to sort of not knowing what's going next, taking a look at the different data that's become available to us, practicing self-care, making sure that we are continuing to accept the risks that are there, but at the same time, taking all of the reasonable precautions that we know that are available to us by wearing the masks that we know are there, hand washing for those of us who are older or those of us who are caring for older adults, making sure that we are limiting folks who are coming into the home, or making sure those folks have been taking precautions that we're going to be going over today, limiting exposure, making sure that we're eating well, taking care of health risks and all those sorts of things. As we're starting to reopen, erring on the side of caution, making sure that we're protecting and being protective of being aware of the things that are going on, and realizing that as this goes on, this is really an evolving body of knowledge. One of the things that Laura and I have talked about, and that we're all trying to do, is making sure that as we're looking at data and we're looking to sources of news and things that we're trying to gather, that we're looking at good data. Some of the sources that we've come to and we've come to recommend, certainly the CDC is a great thing, and this is their website here, and we've put some of them up here for you. The state of New York gives constant updates on things that we can look at and take take certain response information from. The Institute for Health Metrics is an independent data source which has been doing constant projections, and they've been really quite accurate on terms of what's going to be projected in terms of where the coronavirus is going to be, COVID is going to be coming back, where spikes are going to be reoccurring, as things are going to be, unfortunately, people are going to be passing away, different things like that, so that you're not overreacting, certainly not underreacting, but maintaining a sense of calm, a sense of preparedness, and a sense of good reaction and appropriate reaction to what's going on.
Right. So, and here I'm talking a little bit about preparation that we can all do in terms of equipment. But I have to emphasize how much this is a work in progress. And that was very much brought into focus for me just now, because at about 12:45, New York State Department of Health just issued further guidelines regarding equipment. So it is, as Melissa was just stating, so good to keep up with the new guidelines and data. I think that's been one of the challenges for all of us, is how to keep in front of what we're learning about COVID-19 and protecting ourselves appropriately. So in the first piece, which I know everyone on this call is already aware of, is the importance just of having the personal protective equipment, both for ourselves as well as the older adults we're caring for. Having masks, gloves, soap and water is definitely, they've shown that soap is very effective with this virus, but some people like to have the convenience of hand sanitizers. And then important to keep thermometers on hand. Again, for anyone who's in the home environment. So that goes for both the client themselves, but also for family visiting, for formal and informal caregivers, whoever is entering the home. In addition, though, especially when there is a suspicion of somebody being exposed to COVID-19 or having it, it's important to also sometimes have a higher level of equipment. And one thing that I noted in this 12:45 email that I was just looking at is that there's really much more of an emphasis now on eye protection. So that means either having face shields or goggles to protect the eyes, as well as if there's concern about aerosols being sprayed, that gowns or scrubs, something to protect clothing is important. And then and I know a lot of us in the news have heard about all the different types of masks. And just as a bottom line, right? And that was always changing, right? To begin with, it was don't worry about the masks, but keep them for healthcare workers. And now we're at the point of no surgical masks, which do filter out, I read 70 to 80% of viral matter. And then there are N95 masks, as well as what's called KN95 masks. At 95 because they will filter 95% of materials. There are KN95 have not been tested as much, but still do in many cases have approval of the CDC. And I think, you know, one of the challenges that we've all faced is that, you know, finding reputable vendors, hearing about equipment that was, you know, promised that it was good, but wasn't. And there continues to be a shortage, so that even today, in this Department of Health directive, they were stating that N95 masks do need to be reused, even by healthcare staff, because there are still shortages. But these are the types of things that you would want used if somebody is actually has COVID-19 or is, you know, or there's a suspicion of it. In addition, and one thing my home care agency has really emphasized is that we're aware that a lot more of the medical appointments are being done either by phone or video chat. And there's an importance in people having equipment at home that's going to allow them to share with the doctor or whoever the medical personnel is, their vital signs and numbers, so that they can be appropriately followed up on. So blood pressure cuffs are an excellent thing to have in place. For a while, I know that it wasn't so easy to get them, even to order them, there were waits, but one should be able to at this point. Pulse oximeters, and again, to be put on one's finger to measure the levels of oxygen, then those were particularly important because they showed again and again that a lot of people, even when their oxygen levels would be going down and they would not have awareness of it, they even would be able to still have enough breath to talk, and yet precipitously the oxygen was going down. So the pulse oximeter is also very important to have, and scales, you know, to weigh. And this again, especially if an older adult may be retaining water, there might need to be a report on whether Lasix needs to be upped or not, or if there is swelling going on. So all of those things, as well as, of course, thermometers, as we mentioned, in order to be able to take temperatures twice per day. Okay. All right.
So one of the pieces of, another piece of good news, along with all of the things that we've learned and continue to develop, and working through things and things becoming more available, is that we have had, as we're developing, a greater availability of testing options. Whereas a few months ago, it was very difficult to get a test. There were a lot of steps that you had to go through, and it was hard to find a testing center. Now we see that many physicians have testing options. A lot of the urgent care centers around have testing options. And it is, there are some different, you know, it's pretty easy if you go into, or arguably reasonably easy to get a test going into different places. So there are also tests for COVID, as well as tests for antibodies. So if you go to a doctor's office, whatever it is, it's a great idea, even if you've been home, to have that antibody test for any workers who are coming into your home. If you're going out, if you're going into a congregate facility, to have that COVID-19 antibody testing, which is a blood test instead of the nasal swab or saliva test or whatever kind of testing option that you're using, that can be done. There's also now a test that's available through LabCorp. You have to meet certain criteria for it. It's called a pixel test that you can request. It can be sent to your home under most circumstances. Again, there's some different criteria for it if you go online, and that can be done in home and mailed back to the lab. It's a fairly reliable lab situation, where that can be done, and you can send it back in and have the testing done without leaving the home for that frail individual who doesn't want to leave a home service. There are also some home visiting doctors who are coming out into the community and doing tests home and sent into the home. Of course, as we know, there have been accuracy issues up and down with the tests. We have had certainly 305 West End, the community that I work in. We've been very fortunate here to be COVID-free for some time, but we did have cases of some of our folks who came up where they were initially negative. The tests were done very close in, and then the folks came back positive, then back negative again. So those tests have been had differing degrees of accuracy, and there is, of course, a possibility of being still contagious. So it's not 100% reliable. Not 100% reliable still, so you still need to really exercise caution. If you have symptoms, if you're symptomatic, if you've been exposed to the virus in any way, self-quarantining, making sure that you're practicing good hand hygiene, all the steps you otherwise need to take are certainly much more vital, and things we need to make sure that you're not exposing others to the virus are certainly more important than ever.
Yeah, and one other thing regarding testing is that we, in home care, there is an initiative now whereby Home Care Association, which is an umbrella organization in New York State, it has a grant to be able to train nurses to do the testing in the home. And, you know, they're providing a webinar right now for free, actually, so that people can get trained. The question is going to be then the home care agencies obtaining the supplies, and then also being able to send it to labs. But yeah, more and more we're going to be seeing in-home testing.
In-home testing, absolutely.
Okay. Yeah. So, and both Melissa and I will speak towards this slide. But you know, it's always good to plan ahead, right? And there are all different options. So if there isn't care right now for the older adults that you're dealing with, good to think about the options, and the options are available. You know, despite all of the challenges, there still are home care providers out there, as well as assisted living places that are available. There's definitely been changes. And I'm going to speak a little bit about those on the home care end, and then Melissa will take it from there about facilities. On the home care end, we've seen a drop in the number of home health aides available. And that's for a variety of reasons. Just as many home care clients pulled back service and said, I'm too scared to have anyone from outside coming in my home. By the same token, a lot of home health aides said, I'm too nervous about this. This is anxiety provoking. And then for a variety of reasons, either because they themselves were ill, or a family member, you know, they needed to quarantine. Sometimes there's childcare responsibilities that some of them have, so that we've definitely seen a decline in the number of home health aides. But I think that we're going to, that's going to be turning around right now, you know, now that we're kind of getting into the phase of reopening. And I think that there will be more availability. We've also seen that even for Medicare paid home care, there's been a pulling back of any visits that weren't seen as essential. So that in some instances, someone coming out of the hospital where normally they would have gotten a nurse, a physical therapist, you know, speech therapy, home health aide, that they may just have gotten the most essential of services. You know, their nurse may have come, and as well as physical therapy, but not necessarily having a home health aide. And again, I am definitely seeing a change right now. Clients that I have who are coming home, I'm hearing, no, we did get, you know, home health aide service for the first, you know, 2 or 3 weeks. or whatever was available. But there's been changes also in terms of how much care is given. I know that VNS had an initiative whereby they were lowering hours, sometimes to even just 2 hours per day, in order to get essential things done, and doing contactless shopping, where, you know, they would leave groceries. A lot of cases where there was 24-hour service of 2 different aides for 12 hours now have switched over to live-in service, right? So just one aide providing the services all 24 hours, and that aide then, you know, sleeping there. But that was, again, to be able to minimize the number of people who are in and out of the home. So, Melissa? Yeah.
Yes, and it's true. You know, as you're saying, Laura, it's become really necessary in so many of the situations now because of limiting people and staffing, and because of different concerns, to really prioritize some safety issues over social issues. And certainly in the assisted living model, we have done so in terms of limiting social visits and limiting folks coming in for entertainment and different things that have always been core to the engagement model that is part of what we do in terms of assisted living and entertainment and things like that. We have really moved more towards focusing on safety over the time. However, it has been really, despite what you hear about nursing homes and assisted living, the ability to cohort folks in an individual apartment and to provide weekly testing or bi-weekly testing for our staff, maintain temperature checks, maintain safe, controlled dining and all of those experiences, and to continue to test residents, maintain temperature checks for them, and maintain all of those sorts of safety controls have really allowed us in most cases in assisted living to keep a very good level of safety for our residents. In our case, at 305 West End, we had only 3 cases of residents in assisted living who had the coronavirus, and all 3 recovered in the community. We had a few other folks who went out, 4 other folks who went out to the hospital, unfortunately, who were not as fortunate. But and in many of our other communities, we're part of the Bristol assisted living, we were also very lucky in those. Some other assisted livings also earlier in this communication process and et cetera, have had other results just because, again, it was a communication process as we went down. But assisted living as an option has continued to be a very safe, in the main option for folks who need that sort of extra level of care that maybe for one or another reason, they're not family to provide, or there's not family close by, or whatever, for whatever reason, psychosocial reason, they choose to live in a congregate setting, but safely where they have their own apartment and that sort of thing. It still presents as a very nice and safe and viable option in that way, and it continues to be a good thing. We're still admitting new residents, we're still working through new residents, and it works out very well in that way. So they've continued to have staff, the staff is well maintained, the staff is checked, and the staff is very, very safe. So.
Yeah. So I want to address advanced directives a little, and start just by saying that this is always something good to focus on. I was reminded of that again. One of our clients who, unfortunately, we had her for 5 years and had live-in service. She had dementia, and we were proud that we had been able to service for so long because her only family was a niece living in London. But we were able to maintain her. She had been a former nurse and had definitely said she wanted do not resuscitate order. But unfortunately, neither she nor the niece had made arrangements for there to be a standing doctor's order, which was what would have been needed. And she did get COVID-19. So there was like a lot of last minute scrambling. It's so important to, at the very least, make sure that a healthcare proxy is chosen in case the older adult is not able to make decisions, although advanced directives is something all of us should have, even those of us who are younger, but particularly crucial because you don't know what's going to happen around the bend, and in addition, to make sure that it is available, you know, so that when EMS, God forbid, has arrived, that we're not scrambling to find a piece of paper, you know, to make sure that it's accessible and everybody is able to get it.
And then, of course, resources. As everyone is sheltering more at home, and even now as we're venturing out a little bit, still staying a little bit more at home. The PSS University that you're on today is such a great way to spend some time. Information from PSS and from Alzheimer's Foundation of America, from other cultural resources like the Metropolitan Museum, Lincoln Center, some of the great Met Opera broadcasts and different ways to spend your time. If you've seen any of the Chamber Music Society broadcasts that are on, there's such wonderful things to do when we can't be out at the theater and doing things that are coming into us now at home. They're just great things to do in this city virtually that we can't do because we're not out today, that really keep us all engaged and fabulous at home. And I know Laura's well in tune with those as well.
Want to go next?
Yeah, I'm trying to. There we go.
Oops, one back.
There we go.
Okay. All right. Yeah. So, and this is just, yeah, in terms of the new normal, right? Because we sometimes hear everybody longingly talking about going back to normal, but I think we've all at this point settled into the fact that it is different. But as we're opening up, making sure, and especially again with older adults, that we're doing that pre-preparation, assuring that restaurants and other public spaces are accessible and safe. Those have always been things that caregivers have needed to do, but even more so now when social distancing is such an important piece, as well as infection control. Making sure that there are, one has wipes all the time, the masks, and just preparing ahead, and with the idea also, and this certainly comes up when somebody has dementia. So they may not be willing to wear masks or other things, but so coping with that as well, figuring out ahead of time, how are you going to manage that? What other safety features are going to need to be put into place to make sure that whatever outing or excursion you do is going to work out. Okay. All right. So as I was, and this is some of the things I've talked about a little bit, but I just wanted to emphasize some of the pieces in terms of agencies and home care services. And as I said again, home care agencies, they will have N95 or KN95 masks that filter 95% of small particles to ensure safe services. You'll find those also, as Melissa was sharing, at facilities and certainly at hospitals. And also important, again, especially when there's suspicion of or knowledge that there is COVID-19, face shields, gowns, and other equipment. We have made sure that caregivers stay home and are quarantined if they've had contact or been symptomatic for at least 14 days. And at this point, since there is such so much more availability of testing, that is absolutely required before someone would start to work with the older adult again. As a matter of fact, and again, this is kind of new this week, one of the recommendations, but it should be adopted by any aid, for any aid service that you're dealing with, is to have 2 tests before someone returns to work, 2 negative COVID tests. done at least 20 with 24 hours in between. And that again is because, as we all know, it could be that one gets a test and then has exposure. So that it's just important to absolutely make sure. Some agencies are not providing service to those who have COVID-19. So be aware of that they either because they're not capable in terms of the available equipment they have, or just in terms of training that have been provided to staff. I know at the very beginning, most home care agencies said, no, I'm not comfortable doing this. I'm not able to. And oftentimes the home care agencies I found that were able to had LPN staff. They had a little bit of a higher level of education for staff who were then able to care for COVID patients. However, that's changed. I know that Visiting Nurse Service, which is the largest home care agency, and as well as HHC and others, definitely are able to take COVID positive clients and provide the services, and they will do that with with a tremendous amount of care involved. But they can take, if the older adult is ill, and also if there's other people in the home, it might be a family member, right? Or I've even had a situation where a private aide was the one who had come down with COVID-19, but I had my agency staff in there. So we had to make arrangements in terms of keeping safe. So yeah, so that was what was done. And sometimes aid services were put on hold with active clients, but as I said before, but the skilled services were still happening, nurse as well as therapies. Okay.
Yeah. So when you do have to use a provider, if you're looking at going out to an in-house, a hospital, or to a rehab facility, or to an assisted living facility, or another kind of a care facility, there are some key questions that you should be asking in terms of how safety and how that facility is handling their staff. And there's some different things that you should be looking at. And you can easily ask this of any of the staff or any of the facility before you go. And know before you go is a good theme for how you should be handling things these days. One of the primary questions that you should be asking is, how are staff being tested and monitored for active COVID cases? And are there any COVID cases among the residents or the patients in the community, and among the staff? Certainly most hospitals and most nursing homes and assisted living facilities at this point, now that we've entered phase 2 pretty much across most of our area, are being tested. They were being tested in the city at a rate of twice a week. Now it's moved pretty much universally to once a week. You want to make sure that that's kind of a metric that you're seeing in the community to keep not the residents or the patients. The patients are being tested periodically. Certainly you don't want to have that happening, but certainly the staff should be tested regularly to make sure that you don't have active cases among the staff. You want to make sure that your facility has an open and transparent communication with all of the partners that are concerned, families, any shareholders, stakeholders, anyone public, about any cases that are active, and that they're transmitting this, and that this information is readily available. So just ask, how is this information, how's the information on any case being communicated to any care partners, and make sure that they can readily answer you with that information. What are your steps for cleaning and sanitization? Are you regularly cleaning your high touch areas? What are you cleaning with? Where are these cleaning processes being taken place? Or do you have signs up that are indicating that you're doing these? Are there checklists for it? How are you in-servicing and training your staff on it? And who's doing these in-services? who's taking care of the sanitization. You want to make sure that there's a robust, ongoing process that's regularly taking place to make sure that the facility is being properly cleaned and that all the sanitization is being taken care of. Also, do they have a program, an ongoing program to train their staff on hand washing, sanitizing, and the procedures for social distancing? For example, in our community, we're having meetings 3 times a week, regular trainings. All the staff on every shift is being gathered together by the administrator who's on staff on for that particular shift. We're doing an in-servicing on hand washing 3 times a week, and on the use of hand sanitizer. Every single employee has a personal bottle that they walk around with of hand sanitizer, and they know to use it before they come in the building, before their temperature is taken, before that form is filled out. They know to wash their hands as soon as they enter the facility. And you want to make sure that those kinds of procedures are being followed in every single facility that you're working with, to make sure that everything that can be done, those basics, are being followed to keep the facility safe and clean for your care partner as they're entering any kind of care situation that you might be taking them into. So again, if you're taking someone out and you have to take someone into a care facility, you want to have that go kit ready. So you never know when something's going to happen. An emergency, the definition of an emergency is something that we don't plan for, right, Laura?
Yeah.
So having that kit ready, because now still in some places we're allowed visitors and sometimes we're not. Making sure that person is ready and prepared is the best way to make sure that they're going to have adequate care and to make sure that they get the proper care. And if someone, or yourself, if you're someone who is a solo ager, gets the care that they need if you can't speak for themselves or that person can't speak for themselves. So we recommend these items: cell phone, charger, because there's nothing like a hospital facility or an emergency room to eat up that cell phone battery, and you never know how long it's going to take. If you've ever been, if you need your glasses or a hearing aid, list of important phone numbers, because if that phone should die or if that person is not able to speak for themselves, having those phone numbers available, because most of us, I don't know if you guys remember your phone numbers anymore, but many of us don't. And that's certainly a handy thing to have on hand. Any advanced directives that are there, list of medications, because current medications, as you know, can really, not having the right medications and not knowing what a person's on can really affect care, especially in a crisis situation. Copy of insurance ID cards, a small amount of cash or prepaid, one of those simple prepaid debit cards that you can pick up in any CVS or Dwayne Reed, so that if somebody needs a little something, they have it if they should be admitted. Certainly the small necessities of life, a hairbrush can make somebody feel a lot better, a toothbrush, and a clean pair of the necessities can make all the difference if somebody has to be admitted.
Okay. All right. So just with that in mind also, right, transitioning to home from the hospital, some things to keep in mind. So as I mentioned again, so Medicare home care is available. There were some changes as of January 2020 to the Medicare system, so that it used to be that an episode of care was 60 days. That has decreased to a 30-day period. They can recertify and extend the care for longer than 30 days. But generally, if you're coming home from an acute facility, from a hospital, and getting Medicare home care, it will usually be within that month-long range. To begin with, when this first started, they were really saying, okay, if somebody needed wound care or really, you know, just very skilled needs, that was the only time that services were provided. But we've, thank God, gotten through that time, and you can usually get home health aid service. And as I said, as well as being able to hire private home care. But again, it's good to plan as far ahead as you possibly can. Another thing I've heard is that especially for certain types of home health aides, it may be a little bit more difficult right now. So depending upon cultural background, I've heard that there's very much of a shortage of Spanish-speaking home health aides, as well as some Chinese speakers. And again, I think that's because in some of those communities, they were sometimes a bit more hard hit. And also just extended families sometimes were pressuring. So even home health aides who weren't getting sick, sometimes their families were saying, well, I don't want you bringing this home, so stop working. And that still hasn't gone in a different way at this point. And as I emphasized before, maintaining that safe environment in the home when visitors come in, so that you're making sure that the older adult is as protected as possible, since they are still the most vulnerable population. Okay.
So again, about the most vulnerable populations, just circling back to knowing before you go and starting to venture out now that we are entering a sort of phase of what may hopefully be the new normal for us. Before venturing out with a care partner or an older adult and looking at the new normal, CDC and taking a look at some different websites and information that are out there on different things that we want to be concerned about. You want to really be careful and be cautious and make sure that we're erring again on the side of caution as we're looking to venture out with folks. And before you're taking a look at going out to a restaurant, if you're thinking of that, or any sort of office or wherever it is that you're going, kind of want to go take a look, if you are on the web, to go ahead and look at the website, or call ahead and chat with the folks or the place you're going. And again, ask, does the business have a policy for keeping their staff and their patrons safe? Take a look and note. Are they checking their employers? Are they following those policies that are out there? Those forms that probably most of you have seen by now, taking temperatures, filling out the forms if their folks have been exposed, if they're experiencing any symptoms of COVID, that sort of thing. Do they have a policy for sanitizing and cleaning their high touch in public areas? When you come in that door and when you look, are you seeing those familiar now bottles of hand sanitizer and availability of those sorts of things to make sure that those things are done? Are you seeing the markings for social distancing? If patrons are waiting, you're now starting to see those familiar looking, lines of tape to make sure that people are standing those, that metric that we're all starting to know so well of 6 feet apart, right? Are the staff themselves and the people that you're seeing working there observing that social distancing when it's possible for them to be doing that? Are the employees wearing face coverings, and whenever that's appropriate, are they observing that themselves? Do you see the signs posted on the doors, on the windows, on different places in the facility or in the business or wherever it is, about caution signs, making sure that they're being observant and respectful of others in terms of hand hygiene in the restrooms, stopping the virus, being cognizant and making sure that they're doing their part to make sure that everyone is doing what they're supposed to do. Basically, what you're really looking for is an overarching theme of the places that you want to frequent and do business with and feel safe in. Is if it looks like it did in January or February, you may want to, and this is a personal decision because everybody is, doing what they feel comfortable with. But if it looks like it did 6 months ago, you may want to stop, look, listen, and ask some more questions before you proceed with caution. I have used too much hand sanitizer myself today, folks, which is why I can't get this to go.
Okay. Okay. All right. So yeah, and so we just want to open up for questions right now. But thank you so much for listening. And this is our contact information. You can certainly feel free to contact either myself or Melissa, either at our phone numbers or emails. Okay.
Thank you, ladies. I'm going to open up the mic. I'm just gonna allow everybody to speak. If you wanna say something, you can just unmute yourself because we think it will be more interactive if we do that. So I'm just going to unmute all of you. If you have a question, you can just speak to us. That'll be nice. Or you can just say hi to us too.
I saw somebody ask about the pixel test.
Yes,
Great. I'm going to share that just a second. Let me just.
you put it on chat, but I couldn't copy it because you were on screen share at the same time.
I'm going to just put it back out here just a second. Give me a second. I'm going to share it.
You
Chat.
put it on the chat.
I'm going to put it in the chat. Yep.
Yeah.
Oh, and I think I did put it in the chat already,
Oh, you did?
Melissa.
Okay.
Uh-huh,
Oh, you did?
yeah.
Okay, good. Oh, thanks. Okay, terrific.
Yeah. So, yeah, because that's the way to order that. And as I said, home care agencies are looking into having the nursing staff be trained as well on doing the COVID-19 testing. So I think that will allow also for a lot of accessibility. And Melissa, you mentioned the visiting doctors as well are beginning to do COVID-19 testing, right?
Mm-hmm.
Yeah, but through nyc.gov also, that's a great resource for being able to look up where there is available testing in the area.
Yep.
So there are other
Anyone
questions?
else?
Yeah.
Have people used this that you know? Have they gotten this through the at-home place?
In New Jersey, I just know one person who's used it in New Jersey.
And they got it and
They got it. It was successful. Yeah.
oh, okay. Well, that's good. Thank you.
So, and LabCorp is certainly
Right. Respected.
right. A large lab provider.
Thank you.
So
That's good to know. It's all been good to know. Thank you.
it's just been, thanks. It's just been, it's been a while. It hasn't been available in New York. I just said to Laura last night, I said, let's go on and see if it's available in New York because it's been.
Yeah.
It is or it isn't.
It is just now. It's been a while that it's been until it's been available in New York.
Is it available to anyone who wants it, or do you have to have?
You have to go in and punch in your particular situation because it has certain, I think if you're over 65, it will take, if you've been exposed, it has certain criteria because of the availability of the test. So just go in and check it out.
Okay.
So
So it's not live. It's
Is there
been anyway,
any
but yeah. Is there any other questions? Yep.
Yeah, or any resource that maybe we didn't bring up that you had questions about.
I'm sorry?
Evidently, they're giving some courses free for grade kids in grade school.
Oh,
Do you qualify? Are you get taking any of those? What's that smell?
Ah, okay. It sounds like somebody is, yeah, having a side conversation. So,
I'm trying to close it.
okay.
I can mute you. That's okay. I'll do it.
Here we go. Okay.
So I guess if anybody has any additional question, they can definitely reach out to us, and you can see the ladies' information. And if you have any question regarding PSS and have any looking for more resources in the community, yes, you can definitely reach out to us. We'll be very happy to help you. Again, thank you, ladies. There's one more question I think on the chat. Let's see. Oh, thank you. Somebody say thank you. Thank you, all of you, for participating with us. Thank you, Melissa. Thank you, Laura. Nice to meet you again.
Yes. Yeah.
Thank you all for joining. We appreciate it, and we appreciate your time today. Thank you so much for having us, and thank you, Shayna.
Thank you again, and have a great rest of the day, everybody.
You
Bye-bye
too.
now.
Okay.
Thank you.
Bye-bye.